Hello and welcome, and I'm pleased that we have Dr. Manish Saxena with us again, and this is a Healthy Hearts Research Engagement Network HARINGEY dialogue, and our focus is on healthy hearts. Healthy Hearts focuses on prevention by equipping individuals with vital health information and fostering meaningful conversations to help them stay well or effectively manage their health if they become unwell. So I'm pleased once again to welcome Dr. Manish, and many of you will have been listening to the first series, some great information he shared there. So welcome, Dr. Manish. I hope all is well.
Thank you. Thanks for inviting me again, Rudy.
So let's get started. How does participating in a heart health clinical trial contribute to medical advancements?
So that's a very good question to ask because, as we know, most healthcare systems world over, they work on, as we call, evidence-based medicine. That if you offer a treatment option to a patient, you need to have some robust evidence behind it, based on which academic bodies, international bodies, like, say, for example, European Society of Cardiology or even NICE in the UK, they make treatment guidelines for patients. So whatever research we do with patients, that all contributes to generating that evidence based on which we make treatment decisions.
So what personal health benefits can participants gain from joining a clinical trial?
So joining a clinical trial can be of good benefit to patients. There might be added benefits from going on a novel therapy, which maybe is not available in routine clinical setting. But without overselling the benefits of a unknown drug or intervention or therapy, I think one of the biggest benefits of coming into research is the close follow-up patients get as part of research, that a clinician, a doctor, a nurse, or a pharmacist, or a physiotherapist, they are taking keen interest in patients, and patients are followed very closely. That can make a big difference to their treatments, their disease, their outcomes. But then also, the bigger benefit is to the society as well, because patients are contributing to developing new evidence, novel therapies, which might not be very helpful for them individually, but it can really help other similar patients in the future. It can really help the community or the society.
So how are participant safety and well-being ensured during these clinical trials?
Let me assure your viewers as well is that clinical research, clinical trials is a very well-regulated science. And even before we start seeing participants for any trial, all proposals are reviewed robustly by a group of independent people, what we call ethics committees in UK. They're reviewed and approved by regulatory bodies like MHRA in the UK or the FDA in United States. And once the study design, the concept, everything has been reviewed in terms of safety, efficacy, in terms of how good it is to different patient populations. But then once we start enrolling patients, and when we start seeing patients again are very closely monitored for safety, because clinical benefit is secondary. Safety always comes first. There's always flexibility. If patients are not doing well or if they don't feel comfortable, they can always leave the study without having to give a reason. So there's always flexibility, but patient's choice, patient's opinion always comes first.
Who is eligible to take part in heart health clinical trials?
So in clinical trials, anybody and everybody is eligible to take part, but that depends upon what the study is looking at, what the disease process they are looking at, and that makes it relevant to certain patients. So we might be running studies in patients, say, with high blood pressure. We might be running studies in patients with high cholesterol and diabetes and heart failure, any indication where there is a genuine clinical need. So patients need to check whether that particular study is for them. But I always tell patients in routine clinical practice as well is that patients' comfort level is very important. And there are some early phase trials, there are some late phase trials, there are some purely observational studies. So patients should see what the study involves and are they comfortable with the idea of what's happening in the study. And they should only and only take part if they feel comfortable with what the study entails.
Why is diverse participation important in heart health research?
That's really, again, a very good question. It's mostly to do with two things. One is the scientific aspect, because with time, what we are doing is that we are moving to more fancy therapies in every specialty, whether it's cancer, whether it's cardiovascular, whether it's cholesterol, whether it's blood pressure. Then very new, expensive class of drugs coming on that can work really wonders in improving a disease process. But in trials, we need to ensure that we try these drugs in patients of different ages, genders, ethnicities, so that we can really evaluate these therapies in a robust way, that which group of patients are going to get the maximum benefit and which group of patients are not the best patients for any new therapy coming on. So from scientific perspective, that's very important. It's important to have that great diversity in your study population that you are trying to evaluate. But then once therapies are available in the market, again, it's really very important to target some of the health inequalities in patients we see. But that can only happen when we have diversity in our clinical trials, so that we can replicate or we understand how these therapies are going to work in different patient populations.
So how do clinical trials improve heart disease prevention and treatment?
So what's happening is that with research, because we all are living longer, science and medical care has really improved in the last 20, 30 years. And what research offers is that research is trying to identify new targets, new therapies for these targets to tackle diseases in a different way. What it is also trying to do, to give an example, that what we also now know is that the targets we are trying to achieve, for example, target for, say, high cholesterol, that's changing constantly, because we know that the lower the bad cholesterol, patients do better in long term in terms of the risk of deaths, heart attacks, strokes. So to achieve those lower targets, we need new therapies, because we know that existing drugs on their own can't bring patients to target. So it's all about finding new targets. It's about finding new therapies to improve patient outcomes. That is where research can make a big contribution to saving lives, to improve patients' quality of life as well.
Thanks for that. And finally, how can individuals join a heart health clinical trial?
So there are various different options. It's always worth looking at neighborhood, because we try to work with some of the established relationships. So we try to engage with many GPs. So it's always worth checking in your GP surgery if there are any research options going on. There are some established partners in research, like, say, for example, National Institute of Health Research. Patients can go on, check on their websites as well. Research Engagement Network, that's an amazing possibility as well, to try to engage and find out what are the research options available in the neighborhood. But these are some of the common ways of finding out what are the research options and are these research options appropriate for you based on your medical history.
Thank you very much. And I can add to that, if anybody is interested, they can just search bridgerenewaltrust.org.uk and they can just fill in an information form on the website, and somebody will be in touch. So Dr. Manish, thank you very much as usual, and look forward to talking to you again soon.
Thank you for inviting me, Rudy. I hope patients find our interaction useful for them.
Thank you.